Welcome back to Your Carolina. We are here to talk with our dentist friend, Dr. Nichols. And I tell you what, I just might as well get ready for the email, the Facebook, the phones to go, because it's something that I think we all have troubles with, and we have some people have reservations with.
Absolutely.
But we all have teeth, or we want to try and keep our teeth, or if we don't have teeth, we want to get teeth.
That's right.
And you can get teeth if you don't have them.
And that's one of the things we're going to talk about, Lumineers. I know we're going to talk about it in a minute, but the one thing that caught my eye was this icon.
Icon. That's absolutely correct.
What is that?
Fascinating
Icon.
product.
I'm going to show this to you here.
All right.
Icon is a material they've been working on for years. You get a cavity.
Right.
You come in, you have to get a shot. We drill a hole into your tooth, and then we fill that tooth.
And by the way, kids hate that.
Not a pleasant experience, and usually
So you associate drilling with fillings.
Drilling with fillings, absolutely.
But you don't have to now.
You have a cavity, you got to fill it in with something.
Sure.
And it's always a bad experience, especially for children, and then nobody wants to go to the dentist when they grow up. And now, Icon is a material that if you catch what we call an incipient lesion, or a cavity right when it's starting. And most cavities show up, you'll see them little white spots on teeth. A lot of times people have braces taken off. They end up with those little white spots where,
food is built in.
Food plaque, it gets trapped there. The acid burns into the tooth. It etches the tooth. We can now go in, no shots, no drilling whatsoever. We place a primer on that tooth, and it actually cleans that bacteria and prepares that space. We dry it off, and then we infuse a clear, highly fluid resin material in there for 3 minutes, wipe it off, shine a light on it, and you're done.
And it's gone.
That's insane.
And there's no reason you can't do that more and more if people just go in every 6 months.
Absolutely.
For the cleaning and the checkup.
That's
And
the
most
most
insurance
important
companies cover that.
It is covered. Under insurance policy, it is a filling. And there's a little bit of a paradigm shift. People think, well, I've got to have my tooth drilled. Not anymore. The most important thing, like you say, Jack, get in there every 6 months. Let them catch it once early. You see a spot, get it taken care of, and don't wait till it's hard.
Well, that's why you go every 6 months.
Absolutely.
To let them find things early.
That's the most important thing.
Well, that's amazing. Now, what about the Lumineers?
The Lumineers.
You mentioned that. What is that?
A Lumineer is actually a laminate veneer, but unlike a traditional veneer, which we actually grind into the actual tooth structure to replace it, it is a ultra-thin veneer. And I'll let you see this, and you can hold that.
And
it looks like just
I know
the
you
front
guys
of a tooth.
aren't there.
It is.
So it's just the visual part of your tooth.
It is a 0.3 millimeter ceramic veneer that is actually laid over your tooth. And we can actually correct orthodontic problems if you have crooked teeth, if you have chipped teeth, broken teeth, if you just want your teeth whiter.
I'll be there tomorrow.
Right.
And the good thing is, right now...
Do you have to have good teeth behind this product?
If you don't, we'll take care of the cavities first, and then we'll place this on there. And
but you wouldn't want to put it over a cracked tooth or anything.
If you have a cracked tooth, absolutely.
Okay.
Absolutely. And it's a good alternative. With adhesive composite bonding these days, we can keep you out of the traditional crowns a lot of times when you have to go in and just totally obliterate a tooth. We're very conservative in what we do. It's a lot pain-free, preserves the tooth structure, and Lumineers have about a 20-year life.
That is amazing. It's hard, too.
And just yesterday on one of the big cable news networks, they were doing a story on how there's a big growing trend of people who want to go to sleep for their dentistry.
Absolutely.
And you guys do that.
That's the greatest thing. We've been doing sedation dentistry. I've been doing sedation dentistry really since day one. It's coming up on 20 years in July, believe it or not. And it's just the greatest thing that you can come in, you can get one thing done, you can get multiple appointments done. And you wake up, everything's finished. And the good thing is people who have sedation dentistry done, who actually come in and go to sleep, have much less post-operative pain. Because while you're asleep, you're not aware. And
you're not tensing up.
You're not tensing up. Your body's not dumping all those stress hormones into your bloodstream.
Well, I've made jokingly, and you can correct me, I've made jokingly have said, well, I want gas when I have my teeth cleaned. I mean, but that's the reputation that I got from dentists growing up. I'm 62, so,
sure.
But it always seemed to hurt.
Yeah, it does.
Well, you've changed things.
Everything is changing. We're moving into 21st century dentistry now.
And ultimately, is it true that cavities will go away, or we won't be taking care of cavities? Is there a way to coat teeth so they won't come back?
They're working on it. They actually, there's a new product, or there's a biological company right now that's working on a type of, they found an enzyme that will actually break up. It's called glycan sucrase, which is actually a material that causes the plaque to bond to the teeth. And what they're trying to do is find that material that can actually place into the toothpaste, maybe even candy, that will actually just not let the plaque. It's almost like a good wax on your car. It's not going to let the plaque stick.
So, how about that?
Well, thank you.
Fascinating. Tell us where you're located, because oftentimes people want to.
I'm in Lake Forest Shopping Center, 1330 North Pleasantburg Drive, right across from Bob Jones University.
We know where it is.
Absolutely.
Dr. Nichols, Merry Christmas.
Merry Christmas to you.
Hey, coming up more Your Carolina. Don't go away. Stay right with you.